Hi there, my name is Gerard Green. I'm a physiotherapy lecturer at Coventry University in the UK. And it is Tuesday the 19th of May. It's always good to check because days kind of blend, days and months now blend into one another. And my role in the university is really as a musculoskeletal physiotherapy lecturer. And I also have an interest in pelvic health physiotherapy. And I'm really delighted to be joined for breakfast with my very esteemed colleague, Glykeria. And Glykeria does lots of amazing things at the university. So she's also a physiotherapy lecturer or assistant professor. And her real area of expertise, of which she's doing her PhD on, is occupational health and ergonomics. And she has also spoken about that at WCPT in Geneva this time last year. It is safe to say that we won't be going abroad for some time, Glykeria. She's also spoke at the CSP conference last autumn, in that she was part of a focus symposium there, which really helped to highlight this really growing area of physiotherapy practice. And she's also involved in some of the special interest groups around occupational health in WCPT. And I think what Glykeria and I were keen to do was, COVID-19 has had a really dramatic effect on how people are working. So normally Glykeria and I would be meeting probably for coffee in Coventry, but now we're perched on our sofas at home. And a lot of people have moved to home working, those of us fortunate enough to be able to home work. People who are working, key workers and people who've returned to work are working in very different landscapes and circumstances. And I think we were both keen to really just have a chat about this, especially with Glykeria's expertise, as to the implications this has for physiotherapy. So Glykeria, really good to see you again. Do you want to just give us a very brief overview of what you're doing, and especially in terms of the PhD?
Yeah, thank you, Gerard. I think you've done a very good introduction, so I don't need to repeat myself on that. I think what I'm going to say is that I have been focusing on musculoskeletal conditions in the workplace for the past probably 4 years. My area of expertise was around how to manage those chronic musculoskeletal conditions in the workplace, to identify how we can support employees, especially those over the age of 50, because obviously with the changes with the retirement rates, they're going to be on high risk of injuries or continuing of having those problems until they're 68 or until they're 70. And also I was looking into what are the plans that the employers have put into practice if they do work, and if the employees are using them to maintain good health at the workplace and manage their condition. Obviously, I think this is still a very big area of research, and it's something we're looking at continuously, and things are changing. But what I have noticed, obviously, it's for the past 2-3 weeks, when the whole situation of COVID started, it looks like a lot of more people will be affected from musculoskeletal conditions, obviously because they have changed the way they've been working. As you said, we are, for the past weeks, we are at home and we're not allowed to go out. So that has changed a lot. The way that we work, the way we behave at home, obviously, physically, mentally, socially, everything has been changed. So it's a big area that we can focus and work on. And in relation to musculoskeletal conditions and ergonomics and occupational health, I'm also part of the committee of the Occup, the Physiotherapy Association of the Occupational Health and Ergonomics. So we have been working quite a lot lately about how we can support physiotherapists to go back into work. We have been working with people who do or did have any maybe mental issues before, and now they find it more of a struggle to return back, and all of those who do have maybe an injury, and obviously that has not been sorted yet, and how we can support them and help them to go back to the workplace. So there are a lot of different issues around workplace and physiotherapy and COVID of what has been done.
Yeah, and I think your research is particularly interesting, especially at this time, because your work focuses on the over 50s, which is a big percentage of the workforce, and it's likely we're going to be working longer, particularly now with the financial implications of COVID-19. And I think that sometimes that age group, they're a little bit more predisposed to a little bit of wear and tear, maybe a little bit of lumbar spine, hip stiffness, knee stiffness. And I think those people in particular are possibly struggling with home working. It's a bit like when I do a lot of my online consultations, I'm sitting here on the sofa. So I know if I do 6-7 hours on the sofa, I just feel stiff. Yeah. And I suppose those people in particular may be getting probably more musculoskeletal issues with home working, would you say?
Yeah, I think what was interesting, and I think I can correlate that with the situation now, is that from my research, what I have identified is that group of over the age of 50, they are a group of people that they don't really ask for help if they had any problems. So those who had chronic low back pain, let's say, or inflammatory conditions, they got used to being in pain. So they were more reluctant to talk to their line manager or employers about those conditions, and they didn't have maybe different equipment or support. So now if they're at home and they still are in this situation, it's going to be even worse, because obviously now they don't have their desk, they don't have a keyboard that it's appropriate to them, and they don't have anyone to actually manage their workloads and plans. So it looks like people, because they're at home, they either work way longer, so they don't just stop at 5 o'clock. And a lot of them will have families, kids. They will need to deal with the rest of the people who are in the house, and obviously what they have to do. And when we say that we need to exercise, we need to move around, and people do sit now more. There is prolonged sitting, and actually in a not a good ergonomic environment. So people will work in their chairs in the kitchen or in the sofa or with a laptop on the bed. And, if they had problems at work in the setup environment, now it's going to be way worse when they're at home.
Yeah, and I think, here in the UK, where both of us are based, there is here I suppose more in England, there is a slow opening up of businesses, but it does look that companies, especially some of the firms that do a lot of office-based work, and it looks like those firms are going to have to continue to home work. But it's also looking from in the media that those firms will continue a degree of home working, whether that's hot desking, maybe, and I suppose that has positives for the company in that they can reduce the amount of city centre office space they need, commercial property. So do you think that's also going to have implications more in the long term, especially for those people who do have additional support needs? But hot desking is not great for that, because if you're in one day and you've got a nice standing desk and a nice chair and a nice setup, and then I'm in your desk the next day, it's likely that when you go back, things are going to be either disappeared or changed.
Yeah, I think with hot desking, and especially this lone working, there are different models of them. And I have seen, police have talked to me about that throughout this research. And some of them would say exactly what you said. They would have an allocated space before in their office with a specific, chair and the desk in the correct height for them and all of that. And then suddenly they've been given a laptop, and they would say, okay, you can work wherever you are in this company. So they don't have a specific chair or desk anymore. They might use, as you said, someone else's equipment, which, if I go to someone else's chair, I will adapt it for my height. And if, and I know about that, but if someone doesn't know, they would work in an uncomfortable position with, equipment that they don't fit for purpose. And the thing is that when we talk about hot desking, it's not always about being on a desk. Like, people who've been given, as I said, the laptop, and then they would go in the canteen of the workplace of their company, and they will work there for hours. Or, it's not. I don't think it doesn't fit the purpose for those who do have problems, especially with health. But if you think about it, even if you don't have any health issues and you've been in a position for a long period of time, you will feel awkward, you will feel uncomfortable. So even for those who don't have an issue now, if they go back to work and they've been requested to be in a hot desking role, I guess they would start, people would start having some issues regarding to their position and posture and all of those things. So it is a big thing that is happening now, and a lot of associations around ergonomics and occupational health, the ARMA, the versus arthritis, the Society of Occupational Medicine, they're putting toolkits together to see how they can help employers and employees to return to work in a safe manner and protect their health.
Yeah, and I think the other thing that all of us, it's what we're using at the minute, all of us are using Zoom quite a lot. And a lot of people, like in the university, we use Microsoft Teams, which is great for our catch up during the week. But I think, I feel quite fortunate at the minute because I'm recording this. I'm on a massive big Mac screen, but when I do some of my clinical work, I'm on a laptop. But I know some people are using those platforms on an iPhone, a Samsung, a tablet, and they're maybe lying in their bed with it, or they're out in the garden, getting away from the kind of noise of busy house like myself with kids. So I think that must have massive ergonomic implications. Doing hours of Zoom holding a phone, or doing hours of Zoom tucked into a corner of the house somewhere on a tablet. Whereas I think sometimes we think that everyone's sitting nice and neatly in front of a nice screen with a nice, the chairs we have in the university. But I suppose the reality is completely different.
Yeah. It's completely different, and I think it will be hard to get away from those positions because that's what you have at home. You don't expect people to have, standing desk at their houses and good chairs and, to be able to have a quiet space. So as you said, if you have especially kids, you will grab your laptop or your tablet and you would stay in an awkward position in a hidden room. And, that's going to be a poor position for a long period of time. And the bad thing is that because we're staying in this position for so long now, people get a new habit of, using those equipment in that bad manner. And I think we need to, reinforce the idea that people who are at home, they will need to exercise. They will need to actually do, I would say, active breaks. So get out, do a walk, go to your garden, make sure you change your position a little bit. Some stretches maybe on your sofa or on your chair, like to be able to move a little bit better and not be so stiff. So definitely they would need to follow some guidance and instructions to have less of those complaints and aches that they would get from those awkward positions.
And I suppose what we haven't mentioned, and it's something that I've seen a lot over the last couple of months, a lot of the patients I've seen online is pelvic pain patients, women with pelvic girdle pain during pregnancy, and postnatal women who've got a variety of conditions. But the thing that comes true is for all of us, our university colleagues, our university students, there has been a lot of stress and anxiety. People may not be sleeping very well. There is concerns about people's kind of present, their future. So there's a lot more stress and anxiety, and we know that's not helpful for managing a lot of these musculoskeletal conditions like low back pain, work-related neck pain, hip pain. So I suppose the current environment of COVID-19 is not brilliant for a lot of these conditions anyways.
No. And I think, as you mentioned, everyone will be affected in a different way according to what they had before. And that's why I've said, we need to be able to manage those conditions now at home and to be able to maintain a good home working policy for us. So I can give some tips in the end of that interview to those people. So it's quite important, to think about that. But also, mentioning what you've said now, I think the problems that we will see, it's also mental stress. And I think we shouldn't forget that musculoskeletal problems and pains and aches get worse when we are stressed and anxious. And a lot of people now get quite stressed, and it's not only because of their condition, but also, you turn on the television and you hear about COVID all the time, and there will be a lot of people who will feel more anxious and stressed about their future, and that will affect their mental health, and indirectly will affect their musculoskeletal health. So it's a big area that we need to work on, how we can support physically and mentally those employees to be able to work better at home, or if they have to go back to the workplace in this COVID era.
And I think what obviously the focus of our talk is very much musculoskeletal, but what I've noticed also in the last couple of months is a higher incidence of people with bowel dysfunction. And I think that tends to be inactivity, more sedentary, more stress, more anxiety, very distorted kind of diet possibly. And I'm seeing more people with urinary problems, which links into a lot of the stress, anxiety, that routine having been completely disrupted, and also a lot more patients complain. Obviously, we see pelvic health patients, but a lot more incidents of sexual dysfunction.
Yeah,
and that. And I suppose the reasons for those are similar for the reasons that a lot of those musculoskeletal conditions are have been flared up as well. So do you think, can you see a time, Glykeria, because obviously you're very much embedded in this kind of specialist occupational health. Can you see a time then when physiotherapists will be doing kind of work-based ergonomic assessments in people's houses?
I think this is what we've been talking about, not to get in the houses, but the first thing is to get back to those who will be in the workplace. And in relation to the houses, maybe we can start doing some online assessments. And I think the other thing, as I've said in the beginning, is the toolkits. So the organizations are trying to create those toolkits for employees to be able to do some self-assessment, because you would have to do a risk management before you go to work. So you will need to do risk management around your home office, the one that you've created. And physios working in the occupational health, they will be able to support those employees working from home, but also those that they need to go back to their workplace. So definitely, and I think people need to look for advice for those toolkits and get informed. There is plenty of advice around, good advice, and we need to keep a routine on these things.
And what are some good resources? So if someone is maybe concerned about, like say for example myself, I kind of know I shouldn't be sitting on this sofa for hours at a time, and I probably then should be more aware of what positions I'm working in. But so what are some good resources that people can find online? Because there's lots of a lot of people are lucky to social media for their information, which the quality of that tends to be quite variable. So where are some good places to look, Glykeria?
Well, I think the site of the Society of Occupational Medicine has produced a lot of different resources in relation to exercise and stretches and how they can support employees at home to work better. The Association of Physiotherapists, so the Association of Chartered Physiotherapists in Occupational Health and Ergonomics, we have produced some leaflets with a lot of links there into pages that they help you to understand some of those conditions that you might have and how you can maintain them and how you can be healthy at home. The societies like Versus Arthritis or ARMA, they will have all created different pages in their websites due to COVID-19, and obviously they've been talking about the strategies that people can use, some exercises again, and good advice. So we could actually make a list of all of those if you want to, and people can have a look at them. The Association for the Health, for the Human Resources, they have also done recently a web page that help employers and line managers to support their employees. And the biggest one is, I think, from Society of Occupational Medicine. They just released a toolkit of return to work in COVID-19 and looking after the ergonomics and the occupational health.
And I suppose that, like, this is a very challenging time for, particularly for musculoskeletal physios, in that a lot of NHS-based musculoskeletal physios have gone to help out their colleagues on the COVID-19 wards. A lot of musculoskeletal departments have shifted to probably a more skeleton service and moved to an online platform. And probably 100% of physiotherapy clinics in the UK are closed, or possibly thinking about the painful journey to reopening. But I do think this does provide an opportunity, in that, as we've discussed, there are going to be big changes with getting people back to work. It's likely that there will be ergonomic implications of that. And I think we're seeing already that this kind of lockdown has had implications for people's musculoskeletal health, for both patients developing new conditions and the people, especially the people you're particularly interested in, those who have problems, who maybe worked, maybe with challenges, but in a supportive work environment, that's kind of being taken from them. So I suppose there are lots of opportunities out there. I suppose my last question then, Glykeria, is how do people find you? So I don't want you to give your address in Coventry, slightly inappropriate, but how can people find you online? Because I know after people have watched this, they will probably have some. So where can we find you, maybe on social media?
Well, I'm in Twitter and LinkedIn, and I think my email address is available there too, so people can email me if they wish to. I'm happy to discuss and to give resources about this. So Glykeria SK would be on my Twitter account. Social media, I'm there, so I can reply to it.
Probably the last question is, so you're obviously a physiotherapy lecturer, and but how has COVID-19 affected your PhD?
Well, I think there are new issues emerging now. So if I was doing that research from the beginning now, I'm sure that would have also extra issues to discuss about, So if you mean in relation to the content, I think there is nothing that is changing per se, because when we go back to normality, we would still need to work with those.
Or has it affected your kind of data collection or any
Oh, okay, I see what you mean. No, I mean the stage now that I'm submitting this year, so I'm on the writing up phase, so I haven't been affected. Well, I've been sitting too much in writing.
But hopefully in a good position.
If this is the one. but I think this is the thing, that from my point of view, because of the knowledge I have and being a physio, my workspace here is quite good, and I have the ability to use quite good equipment, and I've put timers on my phone that they remind me to stand up and do a small walk every hour. So I think this is what people need to do. They need to monitor their inactivity levels, because that's what's happening. And you don't need, a Fitbit or anything else. You just need an alarm clock to remind you every hour. Are you still sitting? Stand up and do a walk around. Is it your lunch break? Go and do a walk. Make sure you're moving and you don't get stiff.
And I think we have amazing physiotherapy students in Coventry. Both are brilliant undergraduates. And those are now working away. Some of them are working online, and some of them have gone back into the health service to help out at COVID-19. And just let's say a really big hello to them. And we miss you all, guys. And also we have amazing postgraduate students. And big hello to all of them. We miss you guys as well, but we hopefully will see you all soon. And I'd like to say a massive thank you to Glykeria, because Glykeria does amazing work both in the university, and she's very supportive of her students, and her PhD is quite fascinating, I find, because I do think musculoskeletal occupational health has always been it's always been a key area of physiotherapy, but I think it's really one of these tiger areas that's really growing and growing. And I think Glykeria's work is really important, especially the work she's done at CSP conference, WCPT, to really engage more physiotherapists in that area of practice, because it's a growth area, and COVID-19 is just going to increase that need for those specialist physios. So Glykeria, a big thank you, and
thank you, Gerard.
Thank you. Bye bye.